Seasonal allergies don't always get treated seriously, but they should. Even mild symptoms can affect your life in ways you may not even realize.
Even 20 years ago, we had available to us many of these non-sedating antihistamines, but still the older antihistamines have clung around.
First-generation antihistamines have been used for the treatment of allergic rhinitis for over 70 years. However, common and sometimes serious adverse effects associated with these medications have been reported.
My name is Paul Keith. I'm an allergist at McMaster University. I'm an associate professor in the Department of Medicine and in the Division of Allergy and Clinical Immunology. Allergic rhinitis is a very common condition that causes itching, sneezing, discharge, and a blocked nose. People, when they inhale an allergen, initially get itching and sneezing and then discharge, and then as the season goes on or they get persistent symptoms, they become very blocked. The biggest effect of allergic rhinitis is on sleep. It makes it difficult to pay attention to what's going on during the day. So for allergic rhinitis, we first recommend avoidance. You can use nasal sterile saline to try and clear out antigen that you're exposed. And usually the first line of treatment is a non-sedating antihistamine. If you fail a non-sedating antihistamine or you go on to get congestion, we usually recommend using a nasal steroid.
Oral antihistamines are one of the most commonly used therapies to treat allergic rhinitis. Older first-generation antihistamines, which people often use because of habit, are commonly used as sleep aids because of their strong sedative qualities.
So in Canada, we still use a lot of first-generation antihistamines that have unwanted side effects. They're very sedating and have anticholinergic effects, which are really unhelpful and cause dryness of the mouth and lightheadedness. So it's really not recommended that you take these anymore. We now have newer non-sedating antihistamines that have been around for 20 years, and these have far fewer side effects, are just as rapid in onset of action, and have a longer duration of effect. So they're much safer. We recommend that patients who have allergic rhinitis that they take a non-sedating antihistamine. So you would know the antihistamines as Benadryl or diphenhydramine, Atarax or hydroxyzine, or even chlortripolone. These are the older antihistamines that can cause sedation and have a lot of unwanted side effects. The newer antihistamines are ones such as loratadine or Claritin, desloratadine or Arius, fexofenadine or Allegra, and cetirizine or Reactin. And then we have some new prescription antihistamines such as rupatadine or Rupall and belastine or Blexten.
It's also important to consider children with allergic rhinitis.
So in the pediatric population about 11 years ago, they stopped the sale of older antihistamines mixed with cough and cold remedies because they were causing too many side effects and they were really unsafe in children. We now have non-sedating antihistamines that can be given to children quite safely, and it's really recommended that you use those first line.
Many people aren't aware how important it is to stay on top of the symptoms of allergic rhinitis.
It's a very good idea to stay on top of it because if you don't treat your allergic rhinitis, you can go on to develop asthma.
At the end of the day, this is a good news story.
I think the good news is that you don't have to take an old sedating antihistamine to get the benefits of an antihistamine. We now have new non-sedating antihistamines that are very effective, and if you don't tolerate one, there are many choices.
To learn more about the use of antihistamines in the treatment of allergic rhinitis, speak with your pharmacist or a healthcare professional.
Well, up to 1 in 3 people have allergic rhinitis in Canada. It is incredibly common and not really well recognized. It's 3 times more common than asthma. And patients with allergic rhinitis may just accommodate to feeling stuffy all the time.
Stuffiness or nasal congestion, although common, can have a significant impact on quality of life.
Part of the problem is that they overproduce mucus and it's constantly draining down their throat and they're having to clear their throat and cough. Also, they'll sound like they're very hyponasal. They just can't create any resonance. Anybody that gets nasal congestion lasting longer than 2 weeks with a cold, you have to think that they have perhaps underlying allergic rhinitis or some other problem. And then what happens is that symptoms are worse at night and it disturbs their sleep. It also prevents them getting into rapid eye movement sleep, so they don't get a restorative sleep. They may just sleep for 10 hours, but feel like they haven't rested at all. One of the problems with chronic nasal congestion is that you don't get a restorative sleep. And so you get something that we call presenteeism at work. They're not absent from work, they're present, but they're really ineffective.
With so many Canadians suffering with symptoms of nasal congestion, what can be done for relief?
The first starting point if they have nasal congestion is simply avoiding irritants and avoiding the allergen. And then you can use a nasal sterile saline to clear the nose of any mucus and try to hydrate the nose so the epithelium is more intact. Then we would use an oral non-sedating antihistamine. If they're still having problems, we go on to a nasal steroid. If they fail that and they're still having a lot of symptoms or they don't want to take that regularly, we do have a new combination antihistamine nasal steroid. We really don't recommend using intranasal decongestants for longer than 3 days because you can get rebound congestion, and that can be part of the problem. Another thing I always recommend Canadians do is to make sure they're taking vitamin D during the winter months. Vitamin D is a natural therapy that helps the body's immune system to fight infection and makes any nasal steroid more effective.
Patients often seek non-medicated options. Nasal sterile saline is a natural solution recommended as a starting point within treatment, helping to cleanse excessive mucus accumulation caused by colds, allergies, and upper respiratory tract infections. Nasal sterile saline, when mixed with a corticosteroid, also helps reduce nasal polyp size, offering relief from symptoms.
So nasal sterile saline is very, very safe because it's not a medicine, it's not a drug. It's just made from natural ingredients that really reduces their symptoms. You can use it multiple times. It tends to clear the nose of mucus and also tends to restore the epithelium so it's intact and doesn't allow allergens through. For children, we never use nasal steroids under the age of 3. And therefore, if they're having a lot of nasal congestion and discharge, it's best to use a nasal sterile saline. It does come in small individual doses that can be given to a child when you're on the go.
There are 2 types of nasal sterile solutions available, isotonic and hypertonic.
You can use isotonic saline, which is the same as the body's composition and is not irritant. Hypertonic saline pulls fluid into the nasal cavity so it goes down your throat. And then in that way, it may reduce the congestion in your nostrils. What I would convey to Canadians is that, as I said, at least 1 in 3 of them have allergic rhinitis. And this really gives them a lot of nasal congestion at different times. Sometimes they may not even know what they're allergic to, but they know they're congested. And so they try different solutions. They'll try oral antihistamines. They may try nasal steroids, which are more effective for congestion. But a simple, safe alternative that anyone can use would be a nasal sterile saline that they could use up to 4 times a day. But when that fails, they often have to go to a nasal steroid.